Immunizations in children. Resolution. All children should receive the recommended immunizations. By Suzanne Kearns. This is a debate for the Human Issues and Dilemmas in Social Sciences class at Vincennes University. My debate partner is Aubrey. There are many people that do not believe in making sure their children receive the proper immunizations in childhood. Some are religious beliefs, while others fear that the immunizations will harm their child. There are still others that believe your own body will take care of itself, or that the disease we are immunizing for no longer exists. I will debate the fact that children should receive the recommended immunizations. It is important for the health of the child and the health of our society. 1. Vaccines save children's lives. The Center for Disease Control estimated 732,000 children were saved from death, and 322 million cases of childhood illness was prevented between 1994 and 2014. Last winter alone, 147 cases of measles spread into 7 states plus Canada and Mexico. Before the vaccine in 1963, almost every child got the measles, and an average of 440 died from measles. Important fact is that vaccines prevent potentially fatal diseases. 2. Being vaccinated protects the community and future generations. When parents opt out of vaccinating their child, the risk of an outbreak increases in that community and can spread globally. Vaccines help eradicate diseases for future generations. The vaccine eradicated smallpox. We no longer vaccinate for, and the last case in the United States was in 1948. Other diseases have been decreased by 99% because of vaccines. The disease is not gone, it has just been decreased due to vaccinations. Someone with the disease can infect someone not vaccinated. Children die every year from vaccine-preventable diseases. 3. Vaccines are safe. The ingredients used are in small amounts that do not cause harm. The toxins used are mercury, aluminum, and formaldehyde, are used in small amounts. You're exposed to these more in the environment and infants in breast milk and formula. Vaccines are tested for 10 years before being used. Severe adverse reactions are 1 in a million. Adverse reactions are redness and swelling at the injection site and fever and rash. It saves the family time and money. If a child gets the disease, the medical bills would be costly and time away as the family is in the hospital with the child. Approximately $10,376 a case is spent when your child gets the disease. 1 out of every 20 previously healthy children who get measles will come down with pneumonia. 1 out of every 1,000 will suffer inflammation of the brain, which can lead to convulsions and mental retardation. 1 or 2 out of every 1,000 will die. Some believe it's a violation of their rights. Children entering daycare, preschool, or public schools have to receive their immunizations. This protects the other students. There is an exemption for medical reasons, religious, or personal belief reasons to opt out of immunizing your child. Physicians need to communicate better with the parents about immunizing their child and the importance of their child receiving the recommended immunizations. What about your child's rights to remain healthy? In conclusion, I believe that children should receive the recommended immunizations as they will protect the child and they also protect the community. When children do not get vaccinated, we can have an outbreak of the disease in areas where they are not vaccinated. The serious adverse reaction is very rare, and the local reactions can be reduced by giving Tylenol or Motrin prior to the immunization. Working in healthcare, the more people that are vaccinated would decrease exposure of the diseases by healthcare professionals. The safety and welfare of children depend on the parents' decision to vaccinate them as recommended by the physician. You as a parent probably received the recommended vaccination as a child, so why put your child at risk? We have seen an increase in some diseases due to parents not vaccinating their children. As stated before, it would also save time and money. Medical care of someone with a disease is expensive and time-consuming. The child would not be able to live a normal life. Impact on society is also great. The more children who receive their vaccine, the less the society will have an outbreak. I want to thank you for listening to my side of the debate.